Whether it's a need for a primary care doctor or a specialty doc for something like mental health care, it can be hard to get an appointment these days. The doctor shortage in Hawaii is getting worse, and it's leading to some creative solutions. Gina Mangieri is always investigating and tells us what she's found.
Whether it's older doctors retiring sooner or young doctors driven out of Hawaii, it's been an uphill battle finding a cure for a physician workforce that's way too small. If you've noticed it's getting harder or taking longer to snag a doctor's appointment, you're not alone. A physician shortage in Hawaii is worsening.
We're not keeping up with the increase in number of needed professionals to take care of our patients.
The doctor workforce, already too small, has fallen to just a few thousand, down 51 since last year. That's short more than 500 doctors for our population. And experts say we need to be moving in the other direction and fast, because a net gain of 650 is needed by 2020.
We've seen the retirement age get, lower and lower, in part because of these uncertainties in payment transformation, electronic health records.
We've had chronic underpayment for physicians in our islands, and we can't just suddenly say, okay, we're going to raise the payment for each doctor, because the monies for those payments come through those who purchase the health insurance, and our businesses have to remain healthy.
These and other factors are driving doctors out faster than they're coming in, especially in rural areas.
We already have critical shortages on the neighbor islands for almost all specialties, including primary care.
The Big Island is the worst, more than 40% understaffed. Maui County and Kauai are a third under what they need. People on some neighbor islands in need of trauma care, orthopedic or other surgeries, even some childbirths, have to fly to Oahu.
Trauma is a really big, really serious challenge. And certainly behavioral health, mental health, even for children.
We're working with nurses, pharmacists, and trying to build teams that will take care of the patients and our needs for tomorrow.
Meanwhile, cities and states across the mainland are taking aggressive recruiting steps that lure Hawaii doctors and med students from tax breaks to medical school loan payoffs. Is there a big fix?
Well, certainly a no income tax for doctors would be very attractive. Physicians here in Hawaii are dealing sort of with a difficult situation where you have lower reimbursement than you do on the West Coast and much of the rest of the nation, and you also have higher costs of living.
Lawmakers set aside some money toward a loan help matching program in exchange for a 2-year commitment to working in the most short areas.
If it could be expanded to longer, 5 or 7 years, it could do a couple of things. One, it could actually pay off more. But two, someone would be much more likely to place roots in that community.
The medical community is not sitting back waiting for policymakers to fix it. The University of Hawaii John A. Burns School of Medicine is recruiting more broadly from students taking non-traditional paths toward med school, even business and engineering degrees, or working adults from emergency and rescue services. They even gave 1/3 of a recent class a full ride, and the dean wants to do more.
I would like to have a situation where we had a sufficient endowment for medical students that we could give every student coming to our school a full 4-year scholarship. That would allow us to retain these students and also minimize the number of our most talented students who have multiple offers throughout the U.S.
In a follow-up report later this week, I'm looking into one of the other big solutions many are counting on, telemedicine, which helps one doctor to reach far more patients. We're looking at the pros and cons of care delivered by camera and screen instead of face-to-face. That's coming up on Thursday. Gina Mangieri, KHON 2 News.